My name is Saj Rambab, one of the respiratory therapists at Morlen Health.
Hello, I'm Ed Birnbaum. I'm also a respiratory therapist with the Morlen Health home-based pulmonary rehabilitation program.
And welcome to Breathe Better 101. The topic for today is oxygen therapy. What is oxygen therapy? So a treatment that provides you extra oxygen. Normally, your lungs absorb oxygen from the room air, the air around you. Some diseases and conditions prevent you from getting enough oxygen, and your doctor and your respiratory therapist will determine whether you need oxygen at home O2, based on arterial blood gas testing and or pulse oximetry. It's part of the home oxygen evaluation. Oxygen therapy is considered a medicine, therefore it must be prescribed by your doctor.
That's right.
Who needs oxygen therapy? Somebody who has low blood oxygen levels, and it can be caused by certain acute and chronic conditions, acute exacerbations, and chronic conditions.
Right. So sometimes if you're having an acute exacerbation or some acute illness that's going to be here today and gone tomorrow, you're going to not be getting enough oxygen from the air that you breathe, what we call room air. It's all around you for a short time. Some people are going to need it for a longer time, and we'll go into much more detail about this.
How can oxygen help? If your oxygen level is too low all the time, O2 can help you live longer. If it's low with activity, it might help you become more active. If it's low during sleep, it can help you sleep better and or avoid getting sicker. If your oxygen level is not low, O2 therapy or oxygen will not make it easier to breathe.
That's right.
Therapy systems, we're going to talk about a few of them. And the first one we're going to talk about, which is the most common, is compressed gas. Most of you have seen these compressed gas cylinders in the hospital, usually the larger E cylinder. It's what we use in the hospital day in, day out. It's 100% oxygen and it's stored under pressure. And it can become more portable when it's used with an oxygen conserving device. Most patients upon discharge from home will generally get this E cylinder or maybe a D cylinder for home with continuous flow. You would have to get your physician to order you or your provider to order you for an oxygen conserving device evaluation to get an oxygen conserving device.
Right. And that's usually if you're going to need it for more than a short period of time. We'll go into more detail about this as well.
So systems available for home oxygen. So you have this gentleman over here with a portable oxygen concentrator, which generally delivers pulse dose, but can do continuous flow, but it's low setting. So it probably maxes out at 3. You have the cylinder, which can give you more flow, but it's continuous, so it'll run out quicker. The blue one here is a stationary or home concentrator. They can go usually to about 6. You can have high flow ones that are a little bit bigger. They can go up to 10, sometimes 12. Here you have the liquid oxygen system, which is, we'll discuss later. It has cold liquid oxygen in there. And then here you have a type of regulator that's called the oxygen conserving device. So these settings here are pulse dose settings. They're not continuous flow settings. They're not 1 liter per minute. So this 4 here does not equal 4 liters per minute. It does have a continuous flow setting, which is 2 liters per minute, but you only want to use that in emergency because generally these are going to be on smaller cylinders. And if you use it in continuous flow, it will run out a lot quicker.
So this looks like a lot of different choices, and each one has its own pros and cons and things to think about. We're going to hopefully sort this all out for you so you'll understand what these different choices entail and what they can and can't do for you.
Compressed O2 tanks or cylinders. So it is 100% oxygen. It's compressed under high pressure, can be lightweight, portable, and long-lasting when equipped with an oxygen conserving device. Example, the pulse dose, which we talked about before. The old cylinders used to be made out of steel. These are made of aluminum, so they're significantly lighter, but they're still very clunky. So you can see in this picture, this gentleman is trying to put his cylinder in his trunk, which is a no-no. You should not put your oxygen cylinder in a trunk. versus this gentleman here who has a portable oxygen concentrator, which is lightweight, and it just slings over his shoulder.
Right. So compressed O2 cylinders and concentrators, portable concentrators are one kind of choice. Again, more detail coming up.
And with oxygen concentrators here, we have two examples. One is the big stationary home oxygen concentrator, and here is the portable oxygen concentrator, or called a POC. So it takes room air and it filters out other gases. So it goes from about 21% O2 and goes to about 90% concentrated when it comes out. It's powered by electricity. You can plug in at home or a rechargeable battery, especially for the pulse dose portable. And it comes for a variety of sizes for use in and away from home.
Right. And these have become increasingly more popular, but again, we'll go into more detail.
There's also liquid oxygen systems. So it requires a stationary reservoir at home. So this big thing here, it looks a bit like a robot like R2-D2. And then you have your small portable tank or reservoir, as some people like to call it. And it stores 100% oxygen, and it's very cold. Oxygen becomes a gas when it's released from its container. So it goes from here, you have to plug it in. I think you can see this gentleman here plugging it in. It sort of docks, and then the liquid goes into this one, and that's how you use it. There's a special cannula you hook up to it, and then that's how you get your oxygen from that liquid system.
So why liquid? You could take all the oxygen that's in the room you're in right now. If you froze it to freeze it and turn it into a liquid, it has to be incredibly cold. I think it's way less than 100 degrees below zero. But then that turns it into a very small quantity of liquid. A whole room of gas turns into a very small liquid amount of liquid that can be held in a large amount in that cylinder that you see, and in a smaller amount, but still quite a bit in the portable. So that makes it very efficient and takes up very little space. But when it gets any warmer at all, it turns into a gas.
So in-home systems, pros and cons. So with your stationary oxygen concentrator, mostly it's your only choice. No tanks or reservoir to change or refill, so that's a plus. Works well with low flows, up to 5 liters per minute, and some can go higher. They are noisy, not so good for people needing very high flows. It'll increase your electricity bill, and it also generates heat. Liquid O2 reservoirs can be best for people needing a lot of O2, example, 100% O2 flowing at higher rates. They are relatively silent. Reservoirs must be refilled often. The oxygen gradually evaporates when not in use, and also when it warms up. And it's often not available. A lot of companies, oxygen companies, are not even providing this anymore.
Right. They do not want to be sending somebody out to your house to refill the reservoir. It could be as often as 3 or 4 times a week versus almost never. They only have to check on the electric concentrators very occasional to make sure that they're okay. Otherwise, they require no attention from them.
Now you have your continuous flow versus pulse dose. So continuous flow is the oxygen is flowing all the time and it doesn't need to be triggered. So if you've ever been to the emergency room or to a hospital for a procedure, they'll put a nasal cannula on and they'll turn on that oxygen, usually 1 or 2, and that's continuous flow. The oxygen is flowing all the time. The pulse dose, or the oxygen conserving device dose, it must be triggered by inhaling through your nose. It saves a lot of oxygen and it's battery powered, so you don't have to worry about it being plugged into the wall. But you might not get consistent triggering, especially when you're asleep or if your nose is stuffed up. So if you breathe through your mouth a lot, you're not going to be able to trigger the pulse dose. And note that liters per minute only applies to continuous flow. Published flow rates for pulse dose systems, both tanks and portable oxygen concentrators, or POCs, are given in units that apply only within a brand and model line. So the take-home point for this is continuous flow. It gives you oxygen all the time. Pulse dose is only triggered or puffed into your nose when you breathe in through your nose.
And the amount that comes out with each pulse is different from one brand to another, and even within a brand, different from one model to another. That's an important point. We'll talk a little bit more about that in a bit.
Portable tank systems, and the asterisk there is tanks or cylinders with continuous flow. So the pros are inexpensive, lightweight, relatively, because they're aluminum. They're quiet and they're good for about 1 to 6 hours, depending on the settings. Cons, unattractive. I mean, they are bulky, so you're going to be pushing around a cart. The cylinders must be changed, must be triggered if you're using the pulse dose system. Not so good or not allowed for travel. Dangerous if dropped and or damaged. They can become projectiles if the top of the regulator comes off. So be very, very cautious about how you store your cylinders.
That's right.
Portable oxygen concentrators, pros and cons. Pros, it's more attractive than portable tanks. Some of them have a carrying bag that you put over your shoulder, so it looks like you just have like a bag. Some also pull behind you like you're rolling around a suitcase, so people think you're just always traveling. You don't have to change any cylinders. Light enough to carry, usually. Again, it depends on which model you get. Good for travel. Only ones allowed on planes. Can be recharged in cars that have cigarette lighter adapters, and most cars now have outlets, traditional home outlets. They're more popular, also due to advertising, and can be rented just for travel. Cons, the output varies and drops off at higher flows, may be heavier than cylinders with OCDs or oxygen conserving devices, the pulse dose. They're noisy, more expensive, and not all are covered by insurance. Must be recharged about as often as changing tanks. Most portable use pulse dose to save battery power, so it's triggered not for sleep. Some of them do have continuous flow, which you have to switch to, which you can use for sleep as well. Many varieties, hard to compare features.
That's right.
Liquid pros and cons. So the pros, it's lightweight for a lot of O2, continuous flow of 100% O2, can manage higher flows for longer periods before refill. Cons, it's not consistently available. So a lot of providers, oxygen providers, don't use it anymore. Leaks as it thaws or as it warms up, must be handled with some care. It's very cold, it can damage the skin, and it needs a reservoir.
That's right. And it's not going to be something that you're likely to have unless you are not otherwise able to get enough flow of oxygen because your needs have become so high. That is the case for a relatively small number of people, but for those people, it could be a huge advantage having liquid portable.
Now, some of the types of delivery interfaces, we'll go over the three main ones. The nasal prongs or cannula, it's fine for most. That's what the gentleman here is holding. You can eat and talk. It can dry or irritate. Not so good for higher flow rates. So the max it can go is really 6 liters per minute before it's uncomfortable in the home setting. In the hospital setting, there's different types of systems, but that's a different topic. Masks, most hold CO2 at lower flow rates, so you should go at 6 liters per minute or above. And it's uncomfortable for many. And you have two types here, the green one here, which is called a simple face mask, and here, this one's also called an oxymask, which is a special device. And it's also, it can get higher concentrations of oxygen, but again, the flow's got to be a lot higher. So it's generally not that well used at home. Can be used for cluster headaches and migraines, but it's not very common. And then the oximizer pendant, so it's this one here. So you can still maintain the lower flow rates, but this reservoir holds the oxygen. So when you breathe in, you get more oxygen than you would traditionally. So it's got that reservoir, so you're breathing in a little bit extra oxygen. And also it's only through your nose.
That's right.
So the nasal cannula, it's small, flexible plastic tube that directs oxygen into each nostril, can deliver from 1 to 6 liters per minute. Generally, the oxygen range is 24 to 44%. Patients with COPD using nasal cannula should not turn up their O2 without checking with their provider. This is by far the most common oxygen delivery device.
Right.
Oxygen therapy safety measures. So, oxygen can cause materials that are flammable to ignite more easily and to burn far more rapidly and actually completely. So, if you're using oxygen, you should never smoke or be around people who are smoking. Never use paint thinners, cleaning fluids, gasoline, aerosol sprays, or other flammable materials. And stay at least 5 feet away from gas stoves, cleaning fluids, gasoline, aerosol sprays, candles, or any other flammable materials.
That's right.
Risks of oxygen therapy, dry or bloody nose. So, what the picture is here is actually a reusable home oxygen water chamber or humidifier or bubbler, many different names for it. So what you would have to do is there's generally a low level line and a max line. You would fill it up with distilled water. You have to use distilled water. Do not use tap water. You don't want that blowing into your nose. And then you just screw that back on. And then this part screws into your concentrator. You can only use this on a stationary oxygen concentrator. It is not for use with portable, because what will happen is if you use it on a portable, the water can shoot in there and that's going to shoot into your nose, and it'll be pretty shocking if you get a blast of water into your nose when you're not expecting it. So if it's dry, try to get this. You can also use a saline nasal sprays. Skin irritation. You get the skin irritation with a nasal cannula, just rubbing against your nostrils. They do have a few different types of cannulas, some that are wider in the nostrils and some that are thinner. So you might have a couple of options there. And then you can get irritation over the ear. So sometimes if you have that irritation over the ear, they have these little foam pads that you can put around there and they protect your ears. Of course, risk of fire, we already talked about that. And then compressed oxygen gas cylinders can explode if exposed to heat. And honestly, if the top, somehow if it falls and the top of the cylinder breaks off, it will become a projectile and it'll go through walls. So you want to be really, really careful how you store those cylinders.
Right. And as to skin irritation or dry or bloody nose, let your oxygen provider, whoever brings it to you, let them know if you're having trouble. If they are not responsive, let your provider know, because there are, you can get a water bottle if you don't have one. You can get something for the ears and so on. There are solutions. There are things that help, and you're entitled to them.
Living with oxygen therapy, so portable oxygen units make it easier for you to move around and enjoy many of your daily activities. Portable oxygen units make it also easier for you to travel, but you need to plan. So contact your transportation carrier or airline to find out your specific rules. Set up oxygen with a supplier at the location you are going to, especially talk to your DME or oxygen provider locally. They usually have connections wherever you're going, and they can set up a bunch of the logistics and the prescription. And talk to your doctor about home equipment and your home equipment provider. They can help you plan for your oxygen needs, ensure you have enough oxygen to last throughout your trip, and fill out any required medical forms.
The reason we talk about airlines is that when you're on a plane, although the planes are pressurized, they're pressurized to put you, let's say, in Denver, not at sea level, okay? And you might be actually better off having oxygen on the plane. So all of these things take time to take care of, to arrange. You need to be checked to see if you need oxygen on a plane and so on. Start early. As soon as you start making travel plans, don't put off getting these things underway too, to make sure that you have what you need, the oxygen that you need to travel on the plane, to get from here to there, and to have oxygen when you're there at your destination. It can be done, but start early. It takes time.
Question: when should I change how much O2 I'm using? Only after checking with your doctor. O2 is like a drug. It must be the right kind and right amount. It might not help and it might do harm. If you're having an acute exacerbation or a flare-up, follow your plan for exacerbations, contact your provider, and or get help.
Right. There's a couple of key points here. One is it may not help, even if it makes you feel better right now. If that's all you're doing about the exacerbation, you hope you're going to feel better tomorrow. If you're starting to feel the symptoms of an exacerbation, it's more likely to get worse than better, and oxygen isn't going to make it get better. Okay, it's not going to solve the underlying issue that is making you sicker. Okay, so you're putting off doing what you need to do, and in some cases, especially with COPD, it actually might do harm.
Key takeaways: understand that a chronic condition, COPD and asthma, that does not require home oxygen may become acute, so an exacerbation of COPD or a severe asthma attack, and require temporary hospitalization with oxygen. Understand that too much oxygen can be just as dangerous as not enough oxygen, especially with COPD patients, and know the safety measures and risks of home oxygen therapy.
There are also other chronic lung conditions that could require oxygen. Um, so all of this applies to all of them.
Thank you very much. Thank you for taking the time to listen to our presentation. If you have questions, please go to morlenhealth.com.
Right. This is can be a complicated and difficult issue for people to have oxygen at home, but it can help so much. It can be life sustaining, or help you live a better quality of life. We hope this has helped you understand what you need to do and the choices that you have a little bit better. We hope it's helped. Thank you for listening.